Hello everyone, I'm Dr. Wan Izwin Wan Hassan. I'm a consultant psychiatrist and I specialize in geriatric psychiatry. Geriatric psychiatry is a subspecialty of psychiatry where you study and work with older adults from range of 60 and above. So I specialize in not just mental health conditions affecting younger people but also older people, and of course dementia, which is the topic that we're going to talk about today. So dementia is actually a term to describe a range of symptoms affecting a person's cognition. So this can be memory difficulties, this can be difficulty planning, it can be disorientation. So it's a set of symptoms that is affecting a certain individual, and most importantly, a person with dementia, the symptoms affect the activities of daily living. So just being forgetful, not remembering where you put the keys isn't necessarily dementia, but if you are doing this repeatedly to a point that you cannot find your items around the house, or you're getting lost when you're going to familiar places, then this may be a sign of dementia. So dementia can happen for many reasons. The most common risk factor would be age. So the older you are, the more likely you may have dementia. But not necessarily because you're old you'll get dementia. It just increases your risk of getting this condition. So for example, we roughly say 1 in 5 people above 80 may likely suffer from dementia, and the risk increases to 1 in 3 if you're over 90. So it is age related. So age is a common risk factor. Other reasons why people have dementia may be conditions, pre-existing conditions. So there is something called vascular dementia. So vascular dementia is when the brain doesn't have very good supply, blood supply or oxygen supply, because the vessels are not working very well. So this may be caused by multiple factors, and the common ones would be high blood pressure, so poor blood pressure control, poor diabetes control. It could be from high cholesterol. So the kind of things that affects your heart, your other vascular risks, the blood vessels in your body can also affect the blood vessels in your brain, and that can cause dementia. So stroke, for example, can also cause dementia. People can be forgetful after they have strokes. So multiple factors can cause dementia. Other things may be sort of poor lifestyle choices, a lack of exercise, poor diet, stress, a lot of stress during your lifetime, having a depression and anxiety, having a functional mental illness can also increase your risk of getting dementia. Hence, it's very important to get those kind of conditions treated as well. So dementia is more about prevention. So it's about ensuring that you don't develop the condition in the future, rather than trying to get more active treatment when you do get the condition. It can occur at any age, usually sort of, it can occur in as early as your 30s or your 40s. Actually, there are a subtype of dementia called early onset dementia, which affects younger people, and there's frontotemporal dementia, which can affect younger people. But for conditions like Alzheimer's dementia, which is more to do with, having some degeneration, then it can develop a bit later. It can develop probably in your 60s or 70s. So it can develop at any age, but of course, the older you are, the more likely you may get certain types of dementia, like Alzheimer's, for example. But age is always the risk factor of developing dementia. So in terms of trying to treat dementia, most important is to get an assessment first. The funny thing about dementia is that just because you're forgetful doesn't necessarily mean you have dementia. A lot of people out there are forgetful. I'm forgetful sometimes, but it's the level of forgetfulness, the severity, the frequency. Those are the kind of things that that helps in order for us to make a diagnosis. So the first step is actually trying to get an assessment first, and that may involve seeing either a psychiatrist or a geriatric psychiatrist, seeing neurologists, seeing a geriatrician. So those are the kind of people that could help you with the first step. There's many places that does assessment, memory clinics or neurologists or psychiatrists who can help you do the first step, make the first assessment, the memory test. We then may send you for a brain scan So that's very useful because we want to make sure that you're not having a stroke, or you're not having, no changes in your brain or tumors in your brain that's causing the memory problem. We'll send you for blood tests. So it's always a range of tests that we do first to get an assessment. And then after the assessment, only then we can sit down and decide which treatment is suitable for the person. So dementia is a progressive, irreversible condition. Unfortunately, you cannot cure, and well, it depends on what you mean by recovery. For me, I think it's about the holistic treatment for dementia, and it's about being very realistic as well about people's expectations of treatment. So the medication, for example, that I've mentioned earlier, so these are your cognitive enhancers like donepezil and memantine. They may help to delay progression. According to research, they may help to buy a few more years of functioning abilities. They may help improve some symptoms. They won't make the memory better, but they may help with perhaps reducing the severity of the conditions. People may find that their loved ones may feel a bit brighter. They may be able to find their words a bit better. So there may be some symptom improvement. However, there is no treatment that I would say would constitute a cure. There are a lot of research currently being done in the pipeline to try and see whether there are ways that the condition can be reversed or stopped in its pace, but nothing at the moment concrete in terms of a full recovery. With dementia, it is about diet. It's about healthy lifestyle. Similarly to many conditions like your heart disease, cancer, dementia is a condition that is related to how you look after yourself when you're younger. So a lot of people, they kind of look at it as a condition that, I'm only going to do something about it when I'm older, when actually in reality you should start as young as a lot of us. And this may include lots of exercise, getting regular exercise. Keeping a healthy mental health is very important because depression can increase your risk of developing dementia. Eating healthily, extremely important. So the research right now, what they're recommending is the Mediterranean diet. So lots of oily fish, nuts, healthy greens, vegetables. So a healthy diet can help reduce the risk of developing dementia. If you're smoking, please stop smoking. Control your blood pressure, control your cholesterol, control your diabetes, control your vascular risks, get plenty of sleep. Sleep is very important. Again, sleep deprivation is also associated with increased risk of developing dementia in later life. And getting yourself socially active, very, very important. People forget that when we get a bit older, we prefer to socially isolate ourselves, not spend time talking to people or around loved ones. But actually, there's a lot of research indicating that being socially and cognitively stimulated can help reduce the risk of developing dementia in later life. The more that you're talking to people, the more that you're using your brain. You can also use do a lot of reading, do more active activities for your brain. Do something stimulating, learn a new language, learn a new skill. That's actually also shown to improve your cognitive reserve, hence reducing your risk of developing dementia in later life. So yes, there's plenty of things that can be done in order to reduce your risks of developing dementia in later life. If you feel that you need to talk to your doctor about it, please do. Extremely helpful.